conventional pacemakers have been there from a very long time, almost it's going to be 100 years of since the invention of conventional pacemakers. And they have helped a lot of patients from last so many years and decades. But with the advancement of technology, the pacemaker technology also has improved. And from a size of a big computer box, now the pacemaker size has reduced to almost small pin, which can be implanted directly in the patient's heart without any leads. And these pacemakers are called as leadless pacemakers. So in this lecture, I'll be covering a little bit about the advantages of leadless pacemakers over the conventional pacemakers. As all of you are aware that at present, leadless pacemakers have very limited indication. And that is because they have several limitations like short battery life, and the replacements are needed more frequently than conventional pacemakers. Plus, since they are directly inserted in the endocardium of right ventricle, limited number of replacements can be done. So in young patients, it's a problem. You cannot do many replacements over their lifetime. Otherwise, there are a few indications which are there for these leadless pacemakers, which I'll be discussing subsequently. Next, please. So the basic thing in a pacemaker system is a lead. So lead has got many components like the conductors, electrodes, insulation, fixation, connectors. But there are many issues with this conventional leads. Sometimes we end up with some mechanical failure like breakage of lead or failure of the insulation which is provided with the lead, leading to pacemaker malfunction. Then sometimes pacemaker lead infection happens. They need to be extracted. Extraction is a big problem, especially if it's a chronic implantation long term. The devices used for the extraction of leads are very costly. Sometimes patients cannot afford them. Then mobility restriction with the patient. Most of the patients, because the pacemaker is implanted on the shoulder side, they tend to reduce the movement. They develop frozen shoulders and so many other problems. Plus MRI incompatibility. So leads have got some issues which have been perennial and persistent. Next slide, please. So as I said, infection rate is around 1%, grossly 1% yearly infection rate, and 2 to 7% for replacement or upgrades. I mean, 1% is for new implantations and 2 to 7% is for replacement or upgradation. Then lead malfunction rates are around 2.5%, means around 3 cases out of 100 will have some or other lead malfunction, either lead fracture or loss of insulation or displacement of the lead. And sometimes, around 0.5 to 1% there redundant leads are there, which needs a device replacement. So overall, the annual complication rate related to the leads is around 5 to 6%. Next slide, please. So that thereby came the concept of leadless pacemakers, because leads were maybe still the weaker link in this almost perfect pacing system. If somehow we can have pacemaker without leads, these complications could be avoided. Next, please. Second important problem was pocket infections. As we all know, I need not elaborate this. It's patient discomfort, hematomas, infections, cosmetic concerns. So if there was a way to avoid all this, that would have been great. And leadless pacemakers have come as a miracle solution to this problem. Next slide, please. So the benefits of leadless approach, as I've already discussed: reduced invasiveness, improved efficiency, and improved outcomes, because the expected complications from the pocket side and from the leads is absent because they are not there. Next. So somehow or the other, we can call it the holy grail of pacemaker technology. Next slide, please. This leadless pacemaker is basically very clear and intuitive way of delivering the pacing to patients who require them, with lot of potential benefits: least invasive, least complications, economic benefits, not in our country, but maybe in Western countries, where fewer implant procedures, less fluoroscopy, better utilization of assets for the hospital. and a great fit for a developed and growing market. Next slide, please. So leadless intracardiac, basically it right now what is available is only for right ventricle in India, but their leadless LV leads are still in development, and leadless ICDs also are in development. Very soon we can expect the leadless ICDs to be available. Next slide, please. So currently the leadless pacemaker available widely is from Medtronic companies, Micra. And basically it's right now they have two models. One is VVI and another is VVIR. So VVIR is basically VDD pacing. It senses the atrial activity by pressure changes and acts like a VDD pacemaker. So that is a new launch, and it is greatly useful for especially younger patients who need leadless pacemaker for certain indications. Next slide, please. Next slide. Next. So leadless pacemaker implantation is a previous slide, please. It's a very simple procedure. After femoral vein access, we go up to the mid portion of right atrium. That is a flexible delivery sheath. We orient the sheath towards the RV apex on the basal side of septum. Once it is properly oriented, the injection is given to check the orientation of device. Then the device is tethered to the RV endocardium. Then we pull it back just to see if it is properly tethered with the help of sutures, and then cut the sutures, take it out, close the wound, and it's done. If everything goes right, this procedure doesn't take more than 7 to 10 minutes to complete. Next slide, please. And it is done under complete heparinization. This is the slide showing how the Micra device adheres to the endocardium. There are four adherent tenets which go inside the myocardium, come back and stabilize the device. Next slide. This is the fluoroscopy image. As you can see, this how this device is delivered with the help of delivery sheath and placed at the basal part of the RV side of the septum. Next slide, please. Next slide. Basically, these slides are showing that the stability and longevity of Micra or leadless pacemaker available is as good as the conventional pacemakers. But in practical experience, we have seen the battery lasts maybe around 8 to 10 years. After that, and especially if the patient is pacing dependent, after that we need a replacement for the battery. Next slide. Next, please. These are all slides demonstrating the deployment of the device. But important thing which I wanted to discuss here is what are the indications of Micra. Basically, in clinical practice, Micra is good for elderly patients, like who are more than 70 years of age, and they need a pacemaker support, because for them, conventional pacemakers, the risk of infection is high, risk of other comorbidities are high. So for them, it is very useful. Just 1 or 2 day admission, you put Micra, then next day they can go home. Least risk of infections, least risk of complications, and they would not need more than one replacement in their lifetime. So one is elderly patients. Second is patients who had recurrent pocket infections. There are many patients who have complement deficiency, and you put pacemaker on one side, then other side, and infections do happen again and again. For patients who have recurrent pacemaker site infection or lead infection, it is good for them. And third category is when patients who have anatomical problems, like SVC or IVC obstruction, you cannot put the leads, or there's some other things which are structurally difficult to place a pacemaker system from the upper limb side. You can use Micra from the femoral side and place the device nicely. Next, please. I think my time is over. I'll not take much more time. Please go on to the conclusion slide. Next, please. Previous one. So in 2021, now the guidelines have come, and ESC has placed them as a 2A indication. that leadless pacemaker should be considered as an alternative to transvenous pacemaker when no upper extremity venous access exists, or only when the risk of device pocket infection is particularly high, such as previous infection or patients on hemodialysis. Leadless pacemaker may be considered as an alternative to strangled single lead ventricular pacing, taking into consideration life expectancy and shared decision making. That is what I said, means elderly patients who have less life expectancy, maybe 10 or 15 years, high risk of infection, other comorbidities, you can consider a leadless pacemaker. Next slide, please. Thank you very much. Next, please. Thank you.